When starting out in research, your file management system is an important part of how you're going to collect your research and store your data, and then also archive it in the future. So you need to look at an appropriate way to keep all your documentation, whether that be in hard copy, electronic copy, or a combination of both. It's good to rely on clinical trial coordinators in your department if you have them to help you with the storage of this data, but people often underestimate the amount of storage that's required, so it has to be looked at from the beginning of the research project. Archiving can often be underestimated as well, so it's important that those costs are built into the budget when you start your project. When actually collecting your data and when your research project starts out, I think it's important to look at who will be delegated the duties within that research project. So who will be delegated consent of the participants, data collection, data input, and who will be responsible for the overall study. And I think those roles need to be clearly defined from the beginning of the research project.
You have to be very careful in terms of the purpose, why you're collecting data, what data you need to collect versus what is interesting to collect. You don't go through the motions to collect masses and masses of data and go and look for a problem. That leads to big issues. What you really need to do if you're going to set up a database is to do things very clearly. You need to have a very clear question or a reason for collecting that data, because it will take a lot of time and effort. You need to know that the way you're collecting the data is going to be complete. You need to think about the fact that when you've got a complete data set, you will be using it in a particular way.